submission. And the first topic, we now move to topical issues. Item number 1 in the name of Deputy Dr. Michael Harty to the Minister for Health to discuss the difficulties with the admissions from A&E departments to hospital wards. The Deputy has 4 minutes to make an initial statement, and the Minister for State has 4 minutes to reply. Deputy Harty.
Cahirlock, thank you very much, and thank you very much, Minister, for coming in this evening to take this topical issue, which of course is very topical, and it is in relation to our accident and emergency departments and the extending length of our trolley queues year on year. The numbers started to be compiled in 2013, and each year they have increased, and each month of this year they have increased. The issue is a year-long issue now. The Department of Health today produced its winter plan 2018 and 2019 to try and address this issue and to blunt the peak that occurs between December and March every year. But the peak is just a peak in a continuing escalation of our crisis in our hospital and emergency departments. In March of this year, we had a peak of 714 trolleys, and earlier in November, we had a peak of almost 600. So this is clearly not just a winter problem, it's a year-round problem. And there doesn't seem to be any improvement in it. The winter plan that was produced today, the 6th of December, very much too late to deal with the problem this year. And it is addressing issues which should be addressed throughout the year, the whole year round. Minister, how are you and your government going to address the health service? The trolley count is purely a symptom of what's happening within our health service. The problem is not in our accident and emergency departments. The problem is throughout the health system. But unfortunately, it is manifest in the long delays in people being admitted to hospital. We have an ageing population, we have changing demographics, we have 20,000 people reaching the age of 65 every year, and those over 85 are due to double in the next 10 years. These are the people who occupy our hospital services and take up most of the time. Yes, it is a tribute to our hospital system that we have people who are living into their old age, but nevertheless, we have to try and deal with these acute and chronic illnesses, and we must move away from a system which directs every patient to the hospital service. It's the default position. When people get ill, they end up in our A&E departments. There has to be a system which prevents that. Sláintecare is a plan which is a 10-year plan, but it still hasn't been implemented. And there will be a 3-year run-in period between the start of implementing Sláintecare and it having an effect on our hospital services. So, Minister, the question I have to you is, what is this government going to do to address the crisis? Because if we don't increase our hospital capacity, the bed capacity plan outlined that there should be an increase in beds of 2,600 over the next 10 years. That is predicated on the fact that if we start to reform our health service now, we will need 2,600 beds. If we don't reform our health service now, we're going to need 7,000 or 8,000 beds. So the issue is really inefficiency and also in integration. We need to have an electronic healthcare record, and we need to have a single patient identifier, which will be the first step in trying to bring efficiency and cost effectiveness, which is most important, into our health service. And unless we start to do that now, Minister, we're going to have the trolley numbers that we have, and our system is locked and loaded for the next 3 years, because unless we start to reform, this problem is going to continue and continue and continue. And unless we start now, in 3 years' time, we're going to have the same problem, except it's going to be substantially worse. Thank you.
Deputy.
First of all, I want to thank Deputy Michael Harty for raising this very, very important issue, and I also want to thank him for his own contribution in relation to the broader issue on health, because I think you've made many sensible and practical proposals in recent years particularly. So I welcome the opportunity to address the issues raised by Deputy Michael Harty. The Minister for Health acknowledges the distress overcrowded EDs cause to patients, their families and frontline staff working in very challenging working conditions in hospitals throughout the country. Hospitals are increasingly operating at or above capacity, with the year-round demand pressures that are further challenged for winter months. According to the provisional data, over 93,000 patients have been reported as waiting on trolleys across the acute hospital system to date in 2018. This reflects the increasing demand for unscheduled care so far this year, especially by patients in the 75 and over age group. However, it is important to put the trolley figures in context. Over 1 million people have attended our emergency departments this year. From May to October 2018, there was a consistent improvement in trolley figures month by month when compared with the same months in 2017. The Minister for Health has welcomed today's publication of the HSE's Winter Plan 2018-19, which will run from the 1st of December 2018 to the 31st of March 2019. The Government has committed significant resources to assist the health services across the winter period, and the publication of the HSE Service Plan outlining how these funds will be spent is to be welcomed. The Department of Health has been working with the HSE throughout the year to ensure that the most effective response to the pressures on our hospital system associated with the winter period. As part of this process, integrated winter preparedness plans have been developed by hospital groups and community healthcare organisations to meet the anticipated surge in demand for healthcare services during the winter months. The plan will run until the 31st of March 2019 and includes a period of focused action from 17th of December to the 13th of January on 9 key hospital sites and their associated community healthcare organisations. Improved integrated working and enhanced community supports are central to the focus period. Bed capacity and home supports are being increased over the winter months. This is a new and innovative approach by the HSE and seeks to build upon the learnings from the previous winters and the success in handling major events this year. Importantly, the HSE plan optimises the use of existing resources and provides an alternative for patients in the emergency department, including extending opening hours and expanded services at local injury units, services, minor injury units and the key primary care centres. A central component of the plan, Deputy, which is already underway, is the provision of an additional 550 home care packages over the winter period to help patients to return home from hospital with the supports that they need. The winter plan will also seek to increase the capacity in Q1 2019 and the National Service Plan 2019, and will identify the sites for investment and the associated number of beds, as well as the agreed capacity programme for 2019. Finally, taken together, these initiatives will increase the number of available inpatient beds in the acute hospital system to over 11,000, a level last seen in 2009. While the coming months will be very, very challenging, and I accept that, this plan represents a system-wide response to this challenge across the health service. It will be led at national and local level by integrated teams representing the community and the hospital services. Thank you, Carter.
Thank you, Minister. Deputy.
Thank you very much.
2 more minutes.
Thank you very much, Minister. Minister, the issue which has been outlined, issues which have been outlined in the winter plan, I think are very good in theory, but I think they're going to be very difficult to implement in practice. And they are superimposed upon a system which is already congested. It's not as if this system that we have has spare capacity. Hospital capacity runs in Ireland at around 95 to 97%. It's well recognised that a hospital that runs at 85% or greater in its capacity works very inefficiently. So we're already in a congested system which is working inefficiently. And you cannot propose to put extra pressure on that system. The Winter Initiative talks about reducing the number of outpatient appointments over the period from the 17th of December to the 13th of January. that just puts off the appointment system that is already congested. There are over 500,000 people who are waiting for outpatient appointments, and your plan for the winter is to actually extend that. You also propose to reduce elective admissions. Again, our elective admissions run in the region of 72,000 patients. So, by reducing elective admissions during this period, of course you will free up beds for urgent cases and the winter peak. But you are again putting off the calling of patients for their elective admissions, and you're extending that waiting list. You talk about decreasing diagnostics within the hospital to free those diagnostics up for acute and emergency care, but those diagnostics are working already at full capacity. You talk about discharging patients early, about having extra A&E consultants on the floor, about having extra consultants on the wards to discharge people, discharging them back to a community that cannot cope with the amount of discharges that are coming already. Our community intervention teams and our public health nurses are worked to the bone, and you are proposing to discharge more patients to a system that cannot cope.
Thank you, Deputy.
I want to thank you for the response, and it must be acknowledged that attendances in our EDs are growing year on, and that the health service capacity review indicates that Ireland has among the highest acute bed occupancy rates in the developed world. The objective is this plan, and there is a plan, to ensure that the most effective response to the winter challenges to in-schedule care provision within available resources. The 4-week enhanced focus period targeting 9 sites of concern builds upon the experience of the HSE has developed in the successful management of major events recently. The winter plan will seek to increase home supports, transitional care beds and increase bed capacity in both acute and community settings. In addition to winter measures, 10 million will be ring-fenced in the NSP 2019 to increase bed capacity. Of course, I take your concerns about theory and practice on the capacity issue and reducing pressure on the system. These are all valid points. But I have to say as well, though, we have to deal with urgent cases as a major priority. Taken together, these initiatives will increase the number out of available inpatient beds in the acute hospital system to over 11,000, a threshold last seen since 2009. While the focus is often on new additional measures that will be introduced, it is essential that the health system maximise the use of existing resources and facilities, including Model 2 hospitals, minor injury clinics, GP out-of-hours services and the primary care centres. Let me conclude, Carla, by saying that we all know that the challenges we face are significant, and of that there is little doubt. However, it is my firm belief that all of us want to find the right solutions. We want patient-centred, evidence-based, results-focused, sustainable solutions to the challenges currently facing our health services. The winter plan has been published by the HSE today, and I believe it is a good plan and optimises the use of existing resources. It represents a system-wide response to the challenges the health system will face in the coming months, and it will be led at local level by integrated teams representing community and hospital services.